Hello, welcome students and parents to our July Parent-Teacher Association meeting. Tonight we have a special guest. We have PJ Ciampino. He's a registered nurse from the Center for Disease Control. He is going to be talking to us tonight about a very important subject that I know all of you have expressed concern, especially with school starting up again in just a few weeks. Mr. Ciampino is here to talk to us about disease prevention and education of methicillin-resistant Staphylococcus aureus, also known as MRSA, for students and parents this evening.
Hey guys, thanks for coming out tonight. Again, my name's PJ Ciampino. I'm a registered nurse with the Center for Disease Control, or CDC as people have called it before. I want to talk to you real quick about MRSA and how it affects parents and students specifically. First off, MRSA is a type of Staphylococcus bacteria, or a staph infection that you might have heard it called. It can be in your nose, in your skin, in your bones, your joints, and it can even enter the bloodstream, so it can be pretty serious. Most common MRSA infections found in the school environments, though, occur in the skin and can cause redness, swelling, pain, and even small pustules with some drainage. I wanted to show you guys a few pictures just so you could take a look at it and see how common it may look. MRSA is spread through direct skin-to-skin contact with an infected person through cuts or abrasions that are not covered with bandages, direct contacts with shared items such as sharing towels or washcloths and razors, even just as simple as uncleanliness or not washing properly with soap and water after contact. Some of the factors that facilitate the transmission of MRSA are crowded environments, schools just like this one, dorms, military barracks, households, correctional facilities, even daycares. We tend to see MRSA. Anywhere you're going to have that skin-to-skin contact, it's going to be important that we keep an eye out for it. And compromised skin, such as cuts or abrasions, that's going to be important for us to keep an eye on too, as well as contaminated surfaces. Anything that we're touching, we have to worry about having MRSA on it. Can the spread of MRSA be stopped by good hand washing techniques? Yes, it can. Super important for us to wash our hands, practice good hand hygiene. Wash with soap and water after skin-to-skin contact. For any of the athletes, it's super important that they shower immediately after sports activities where they have that skin-to-skin contact or skin-to-equipment contact. Cover their abrasions with dry, clean bandages until healed. That helps protect them from transmission. Avoid sharing personal items that come into direct contact with bare skin, like we talked about earlier. Towels, razors, clothing, sports padding. Sports padding could be like football pads, even something like baseball helmets that kids might share. Clothing and towels should be used as a barrier between skin and gym equipment. Especially weight training equipment's a great example. When one student is at the gym and he's using one of the machines, the next student comes on, put his towel in between them and the bench, or make sure you have a nice thick shirt on, something like that. Showers, gym mats, helmets, other sports equipments, they should be disinfected between use and frequently. Frequently, at the end of every day and the beginning of every morning too.
Thank you, PJ. That was very, very helpful and great useful information. I know a lot of the parents out there are very concerned with their child going back to school this time of year. How is this going to affect them? Is MRSA even more prevalent in the school? I thought it was just in the hospital settings.
And you know what? That was a great question, by the way. In the past, it was just thought to be in the hospital settings, but we're seeing that higher prevalence in schools, and I think it is because we're having more of that skin-to-skin contact, and that hygiene, the good hygiene, has not been present, so it's more and more common.
Mm-hmm. Can just regular antibiotics treat MRSA, or is that how we're getting this? Are we creating it? How is it coming about?
Another great question. Now, MRSA, some people consider the superbug, and that's because it is resistant, methicillin-resistant Staphylococcus aureus. This is resistant to some of the medications, but the good news is there still are some medications out there, some antibiotics that can be prescribed to help with the MRSA. One of the important things is early identification and treatment of it. So we definitely want to keep that in mind. Some of the areas when we talked about those pustules on the skin that that we want to be aware of, it's generally in the covered hair areas, like the back of the neck or groin or buttocks, armpits, or in the guys, if they have a beard, we want to make sure we keep extra attention to those areas, because a lot of times that's where we see MRSA popping up on the skin.
All right, very good. Thank you so much. Thanks again. And if anybody else has any more questions, where can they go to get that information?
They can go to the CDC website, www.cdc.gov, or I'll stand around for a little bit after this meeting to answer any questions, okay?
Very good. Thank you so much again for coming.
All right, thanks.